welcome, welcome, welcome. Come on in. So excited for you guys to be here today. Good morning and good afternoon, all one community. I am so happy to be before you yet again for another DEI keynote speaker presentation. But before we begin, let's deal with some housekeeping instructions first. As you have noticed, we are presenting on a new platform, Zoom. The Zoom platform allows us to have live Spanish interpreters during our session. On the bottom right corner of your screen, you will notice a globe that you can click to choose the Spanish interpretation. I want to give a special thanks to our interpreters, Andrea Rocha and Mario Garcia, for their service. As a reminder, for all the questions you will have during this presentation, please click on the Q&A button and enter them at any time throughout this presentation. Also, if you have any technical difficulties, please slide into Tim's DMs via Teams or into chat for Tim to help you. Finally, together, let's welcome our Cosmic Engagement Officer, David Bronner, for a few opening words regarding our speaker. Take care. All, in, all one, David.
I am. Thank you, Lorraine. Um, am I coming through? All right, right on. Well, yes, all one family. It is my distinct honor and pleasure to introduce Dr. Mellody Hayes. Dr. Mellody Hayes rocks the world in a lot of different ways and is a crucial force in this cultural inflection point. We're going through integrating psychedelic medicine into the culture, and how do we do this responsibly? How do we do this fairly? Creating the most healing benefit for those most in need. And yeah, she's just a crucial ally for MAPS work and just the whole movement. So her presentation outline, Dr. Bronner's support of psychedelic medicine is a commitment to living as all one. But what are these medicines and how can they help individuals or communities heal? Come and learn more about the history and clinical practice of psychedelic medicine. Beyond treating anxiety and depression, hear Dr. Hayes' own story of how these powerful medicines gave her the heart of love. And her bio, Dr. Mellody Hayes, founder of How I Healed, is a physician, writer, and public speaker who trained in sociology at Harvard College before training as a physician and anesthesiologist at UCSF. Spirit-filled and known for her heart-centered, powerful public speaking, her writing and speaking focus on the relationship between love and social justice. Committed to creating communities of collective belonging, Dr. Hayes is a founding member of Decriminalized Nature and a co-founder of the Psychedelic Medicine Center, Ceremony Health. As a part of her dedication to increasing access to psychedelic medicine for all communities, she trained in the MAPS MDMA-assisted psychotherapy training for communities of color. She believes these powerful healing medicines can help us develop a better relationship to human suffering, be it race-related trauma, anxiety, depression, pain, or end-of-life crisis. Her writings have been published in Scientific American and the Los Angeles Times, and she has won several writing awards and is a Voices of Witness, VOW, and Voices of Our Nation alum. She is a Rockefeller Fellowship recipient and a John Kenneth Galbraith Scholar. Dr. Hayes is available for media interviews, symposia, keynote lectures, and plenary talks. Follow her on Twitter and Instagram at Dr. Mellody and on the web at www.drmellody.com. Bam, right on. Thank you, Mellody. So take it away.
Thank you so much, David, for that amazing introduction. So let me just say, it is my pleasure to be invited here to speak with you today. I am in great gratitude to each of the 300 some employees who make up the Dr. Bronner family. In addition to creating amazing socially and environmentally conscious products, I am here to let you know you are not just making soaps, you are actually healing hearts. Because the Bronner family is committed to financially supporting increased access to psychedelic medicine, the result of every employee's daily work is directly creating healing for people across the world. Psychedelic medicine is a transformational branch of clinical medicine based in indigenous traditional healing practices. Traditionally, shamans worked with spirit and with spiritual medicines to bring healing to their village. Clinical medicine is now looking to use the power of these potions from traditional healers to bring healing to our modern illnesses. Through increased access to psychedelic medicine, people are experiencing recovery from anxiety, depression, PTSD, and a solve for the anxiety of dying. Let me give you a few examples of how your work is healing the souls of others. Let's talk first about MAPS. The Bronner family has contributed $5 million to MAPS, an organization that has developed a powerful and soon to be FDA-approved medicine for PTSD. The medicine is called MDMA, and it effectively treats post-traumatic stress syndrome, or again, PTSD. Many of us are affected by trauma. Women who have experienced the violence of rape, or veterans who have undergone the trauma of war. After these experiences, many struggle with anxiety, hypervigilance, and find it challenging to ever feel safe again. MDMA, however, is profoundly healing, providing long-lasting treatment benefits, and the results of which are unlike the results of any other medication for PTSD. After treatment with MDMA, people who once felt so unsafe are able to feel whole and better able to participate in their lives, their jobs, and their relationships. And because your work has funded the development of MDMA, you are not just making peppermint soap, you are cleansing souls and making hearts tingle again. The Bronner family is also contributing to decriminalization of these traditional shamanic plant medicines. That means that everyone can have access to healing. Although MDMA is a breakthrough medication, the price to treat people medically with psychedelic medicines is currently extraordinarily high. The average predicted cost may be as high as $10,000. That means that for many people, recovery, health, and healing may just be outside of their budget. Because these medicines comes from traditional healing community practices, the Bronners believe that we should give the power to heal back to communities. To support that goal, Dr. Bronner is funding efforts to decriminalize access to these healing plant medicines, especially by giving $500,000 to Oregon's Psilocybin Service Initiative. Research shows that psilocybin, also known as magic mushrooms, is largely safe and not at all addictive. People treated in clinical studies with psilocybin find lasting and robust healing from depression and anxiety that lasts for years. This medicine is more effective than any other treatment, even for smoking cessation. Through medical care, healing with psilocybin could cost thousands, but through decriminalization, it could be available for all. And affordable access to healing is not merely an issue for victims of rape and war. Again, many of us are affected by trauma. For example, Native American and Native Canadian communities experience higher rates of depression, likely the result of cultural genocide campaigns that aim to kill the Indian to save the child. These communities were subject to horrible emotional violence of separation from their families. Children were sent to boarding schools to colonize them, separating them from their culture, subjecting them to shame and even sexual abuse. Likewise, African American communities have been systematically targeted for economic marginalization through redlining and differential lending practices. Beyond the trauma of policies to create impoverishment, the violence of systematic racism is witnessed in education and health inequalities and in the criminal injustice system. Maybe through access to decriminalized love and help, we can fully grieve the murders of George Floyd, Ahmaud Arbery, and Breonna Taylor. Moreover, maybe through the ceremonies with plant medicine, people will be able to fully release the traumas of slavery. By Bronner's support of decriminalization, I want you to know that your work is not just making soap, you are making it possible for communities to wash away the toxic legacy of generational trauma. Finally, I would like to talk about doctors. Physicians are at extreme risk for burnout and depression. We see this more clearly with the stresses of physicians that are at the front line of the COVID pandemic. And we need our healers whole, especially at this time of crisis. It is estimated that fully 1/3 of physician trainees experience depression. And I was one of them. I spent a lot of time crying and being unable to get out of bed. Were it not for medical treatment with psychedelic medicine, I wouldn't be an anesthesiologist today. I wouldn't be joyfully taking care of my patients every day in the operating room. We are in the middle of a medical crisis, and because of my healing, I can continue the work of being a doctor to contribute to the healing of others. And again, I just want you to know you are not just creating soap. You are making it possible for physicians like me to wash themselves clean of the stresses of patient care so that we can continue to give our hearts in service to you. Your work is really healing souls. You fill gallon-sized bottles of soap, and the money from these soaps make it possible for people to learn to fill their hearts with love and compassion for others. As you apply labels to bottles, you are helping to create medicines that will heal people from the stigmatizing labels that society has been applied to them. I want to close with sharing with you a story. I traveled to Europe and I saw the Sistine Chapel, Michelangelo's masterpiece. It was beautiful and glorious. But as I looked up to the ceiling, all I could think of was, who made these vibrant colors? Who made all those paints? Who made all those pigments for Michelangelo's to make Michelangelo's art possible? I love the Bronners and I thank them for the invitation to speak here today. And I especially appreciate David Bronner's choice to live love through his commitment to social justice. Yet as I speak to you today, I am sending each one of you great love and great appreciation for your service, because you make the beautiful colors that make the Bronner social justice art possible. Thank you so much for the brightness that your work brings to the lives of so many. Thank you.
Thank you so much, Dr. Hayes. We are in great gratitude to have you present with us today. You are a powerful voice for the psychedelic movement, and we honor you. And our first question for you that just came up in our Q&A, and please everyone, we encourage you to put in your questions into the Q&A at the bottom of your screen. First question is psilocybin safe for people with liver issues? I have read it is generally non-toxic. Thank you for your important work, and thank you for sharing your personal experience.
Thank you so much for this question. Psilocybin is, in general, very safe. However, if you had a liver issue or you had an issue for your heart, you would really want to either talk to your medical doctor about the specifics of your medical condition. But by and large, it's largely safe. There are always extreme examples of some people with medical conditions that might make it less safe, but that is actually true for every substance. So alcohol is not fully safe. There's nothing that we can take that's fully safe, but psilocybin is one of the safest medications that I can imagine prescribing that's massively effective for depression, anxiety, and PTSD. Also indications possibly in the future for chronic pain. So we always, as physicians, talk about the risk-benefit ratio. The risks are minimal, the benefits are immense.
Thank you, Dr. Hayes. Our next question for you is, why has MDMA been so breakthrough specifically for PTSD survivors, in particular victims of rape and war trauma?
Thank you so much for this question. I really want to go into the evidence about MDMA and PTSD. So let me tell you, just give you a typical case example of someone who's been treated traditionally medically with PTSD. That person who's experienced trauma, maybe it's childhood trauma, rape, war, and traditionally they would have cycled through years of therapy and multiple medications. They cycled through many SSRIs, tricyclics. They've tried multiple medications and nothing's working. And with treatment with MDMA, why it's so profound that within a year, even a year after treatment, you undergo treatment and in a month you feel better. But even a year after treatment, about 66% of people, or 2/3 of people, are basically don't have PTSD anymore. That is miraculous compared to traditional treatment. So those results are so profound. So not only are your symptoms better, some people don't even have the illness anymore. That is so robustly different from the results from any other medication. So that's why MDMA is so important and so effective. I got really excited and happy and hyper as I talked about this, but I want to make sure I answered the question. So Bertine, did I answer the question?
Yes, you absolutely did. Thank you, Dr. Hayes. And the next question is, why would it cost upwards of $10,000 for treatment through psychedelic medicine? Why is the cost so high?
I'm gonna answer this question in two parts. One, because we don't have universal health care. That's why it's that expensive, because we have not decided that healthcare is a universal need for every single American citizen. So the way that we commoditize healthcare, this is the result. That's why it costs $10,000. Number two, given our current model of healthcare, that the therapy hours that it requires and the level of training that it requires. So for me, I'm an anesthesiologist. There's someone else who would be a psychiatrist. The number of years of training that you have to medically supervise the administration of MDMA, that's a price tag, right? The number of years of training that you have to be a PhD to therapeutically supervise the administration of MDMA. All of these things and the number of therapy hours, all of these things mean that MDMA, this kind of like one-shot treatment that could be profoundly healing, is very pricey. However, when you do the economic analysis, that $10,000, that one-time treatment, the possibility of a one-time treatment, is still cheaper than having someone have years of PTSD, be unemployed, not able to contribute to society, going to doctors for years. So $10,000 in the overall lifespan of someone struggling with PTSD, that's cheap. But for someone, an individual, maybe from a working class background, maybe who doesn't have access to healthcare, $10,000, why should that separate you from the experience of love and peace and joy that every single person deserves? So that price tag, it might be, I just think everyone deserves love and healing. And we shouldn't put a price on our health and our access to health. So there should be no barrier for your recovery and for your healing, right? You don't have to pay for love, right? And so these medications can return you to the heart of love, to knowing that the people in your community and your family loves you. So why should there should be a barrier or price tag for the experience of love? And my prayer and my work is to bring these medications to everyone in a way that's affordable.
I love that. Everyone deserves love and healing.
Mm-hmm.
Yes. Yes. Our next question for you. This viewer says, thank you so much for your work and for sharing with us today. Can you speak more about the experience of MDMA therapy What is it like to go through it?
I personally have not experienced MDMA therapy, but the experience is you have what they call preparation. So you're working with a therapist who learned about your background, the trauma that you may have experienced. You work with them for a few sessions, and then you have the treatment session with MDMA. And so that means that two therapists sit by your side who support you with a loving presence and intention that they want to support your healing. This is very different from the traditional medical model, by the way, because the traditional medical model holds that it's kind of like there's a chronic disease and et cetera. But this model says we're going to be present for your healing, for the possibility of your healing. And so then the patient undergoes, they take the medicine and they undergo this experience of opening, as it's been described, of just opening and being willing to talk about things that they weren't able to talk about really, and to face the things that they were afraid of, that they didn't want to deal with. So MDMA in that treatment session, people then let down their guards to let more love in, to allow themselves to be more vulnerable. Then they undergo more therapy, and then they might have 2 more treatment sessions with the MDMA. Total 3 treatment sessions, a lot of therapy hours. And at the end of this whole treatment process of like softening your heart, opening, letting love in, receiving the support from the therapist, people really have a life that's transformed. When you hear people talk about, women talk about their recovery from the trauma of rape, veterans talk about their recovery from war. I mean, these are men and women who we love and we need in our society to be able to produce, to be able to connect their hearts to others, to still be able to serve. And, you know, these are veterans who receive no other kind of benefit except through MDMA therapy in clinical trials. And so my heart goes out to the people who don't yet have access to this kind of healing.
Yes. Thank you for answering that question. My heart goes out to them too, and that's why this work is so important, right? Our next question for you: do you recommend microdosing with mushroom medicine if someone is suffering from anxiety rather than full-blown PTSD or major depression? And how does one determine what level, oops, I'm sorry, I can't seem to scroll down. Tim, please help me scroll down to this one. But the first part of the question is, oh, there it is. So I will repeat. Do you recommend microdosing with mushroom medicine if someone is suffering from anxiety rather than full-blown PTSD or major depression? How does one determine what level is appropriate? And do you need to work with a doctor if wanting to microdose, or can a person do this on their own?
So I'm a licensed a licensed physician. So I do not recommend any activities or engagement in any behavior that is illegal. I do recommend that people engage in advocacy and write letters to their congressmen to increase research and access and decriminalization for psychedelic medicines. But my role as a physician, I cannot recommend anything that's currently illegal, but I do recommend that you engage with your laws to change them if you want to experience this increased access to this healing medication. The second part of the question was, there is some growing bodies of research. I can talk about the research. I cannot make any recommendations, but I can talk to you about the research. There's growing bodies of research, anecdotal, we need more clinical trials about microdosing as a thing that's efficacious for depression. However, again, I really am basing this in clinical science. The best evidence for efficacy is this flood dose or high dose experience. The flood dose or high dose experience breaks down what they call the default mode network. And actually the evidence is best for when people have an experience of a spiritual transformation or a spiritual opening. The more likely you have that spiritual transformation, the more likely it is the depression or anxiety shifts. Those spiritual transformational experiences are not occasioned by microdosing. They're occasioned by the higher dosing. And this is evident from clinical trials. Again, for all things, when these things become legally or societally available, consult with your doctor to understand really the health benefits and the health risks for you. Okay.
Thank you. Thank you so much. We appreciate you, setting folks straight about the importance of making sure that what you're doing is legal. And Mike Bronner actually sent a chat and said, "I'm glad the doctor is on it." Yes, she is, Mike Bronner. All right. The next question is, can psychedelic treatments help with bipolar disorder? And what about PMDD, premenstrual dysphoric disorder?
Okay, so each psychedelic medicine there's different types of psychedelic medicines. I will just name a few names. There is psilocybin, there is ayahuasca. There actually are several types. And then chemically, we have things like LSD and also ketamine and also these different psychedelics. And every psychedelic, you can say, might have a different indication. Mm-hmm. Psilocybin, currently we know there's really robust evidence for anxiety, depression, and smoking cessation. Mm-hmm. A growing area of research would be ayahuasca. Anecdotally, I can say that some people say that ayahuasca is very effective for bipolar disorder. I can say that anecdotally, we don't have the research for it. In regards to PMDD, mm-hmm. There, again, anecdotally, because we don't have the research for it, there is a lawyer actually, wrote a book called, it's either called like A Very Good Day. And she wrote about how she broke the law, compromised her ability to practice law by making the choice to do this. But her depression and really her premenstrual dysphoric disorder was so bad that she was willing to risk microdosing LSD to get improvement. And she writes, and you can find like a podcast or interviews of her, Elliot Wildman or something like that is her name. She writes about the benefits and how it changed her life and maybe saved her marriage from microdosing LSD. Can I recommend it? No. But there's these anecdotal stories that really suggest that we need increased clinical research and decriminalization so that people can have access to these healing substances.
Thank you, Dr. Hayes. The next question is, do you have suggestions on how to get involved in helping others heal through psychedelics without completely changing course and going back to school to become a therapist?
The most effective way for people who want to help others heal through psychedelics is actually to engage in system change. So that means, how can you support clinical research? How can you write your congressman or your senator to ask for greater funding for psychedelic medicine? How can you contribute to the efforts of decriminalization in your state? And if you don't want to go, if you don't want to go all the way back to school to become a therapist, there are communities of people in the environment of decriminalization. There will need to be people who are what they call lay healers, who can support and hold space for people who are undergoing maybe psychedelic care within their own community. There's multiple ways to get involved. You can look at a program by CIIS. That's a training program primarily for therapists. But I have to just say something, because there's multiple ways that we can heal and contribute to the healing of others. Substances are not the only way. The most important thing that you can do to contribute to the healing of others is to heal yourself, live love, offer love to other people. Do not let a medication or a pill or access to a pill, do not delay. Make the choice to love today. So do not wait for these substances to become available. We have powers and abilities to live our lives from a place of love that start today, right? And it's not just how you love and show up for people in your relationships. It's the most important thing that you can do. And it's not just through therapy, although therapy is a powerful thing, but you can be a presence for love, and you can be the change of love in someone's life, right? So I just always add this. It's never about drugs. It's about how we're going to live and be in relationship to one another. Although substances can help us open, especially if we experience trauma that makes relationships or connections much more challenging.
All I can say is preach.
I try to hold back on the preaching, but I do preach.
Oh, one. Our next question for you is, how does MDMA therapy differ from ketamine-assisted therapy?
I would say because the duration of they hold a similar structure. There's preparation, there's exposure to the substance, there's integration afterwards. But because of the effects of the medication are different, MDMA, you want to actually talk during the therapy. Some people with ketamine, you want to go deep inside, and maybe it may not be as much of a talking therapy, although you can use ketamine to soften what they call a psycholytic experience, to soften so that people can actually go deeper into the therapy process. But sometimes ketamine is about what I call defragmenting the hard drive. You have an exposure, it changes your mind so that you can create neuroplasticity and grow new circuits in your brain. And that means grow the ability to tell new stories, new narratives. The underlying principle of psychedelic medicine is what I call narrative medicine. You've been in a story that broke you down. Maybe your story that all people are unsafe, all men are unsafe, that I am not worthy. Those stories have broken you down and caused dysfunction in your life. You experience psychedelic medicine, creates neuroplasticity, breaks down the rigidity of your previous stories. Now you have the ability to create a new narrative, create a new story. As you create that new narrative, you create a new reality for you to live in. So exposure to all of these substances, and I'll just like doing a little aside about MDMA, is that when your body experiences trauma, you have this autonomic arousal. So you'll have surges of norepinephrine and dopamine and cortisol. In that heightened state, you're actually creating the preconditions also for neuroplasticity, but in that state, you're encoding the trauma. MDMA also causes autonomic arousal. And so again, your body is being flooded with these hormones and this opening, but in that state, you can encode love. So all of these medications is about exposure, narrative interruption, and writing new narratives and figuring out new ways of being in the world. So they say what fires together wires together. And so this is a neurological principle that the traits and the behaviors and things that you use over again, what fires together will wire together. That will become a circuit that becomes your life. You know, they say that a habit, you make a choice that becomes a habit, you make a habit that becomes a trait, you have a trait that becomes a life, right? This is the pathway to illness. You can follow that pathway to illness, you can follow that pathway to health. And so these are just the fundamental principles underlying all of the medications. And that's like just the largest logic that's underlying all the medications, although the format might be different. What people are doing in the Amazon in the jungle, what people are doing with ayahuasca, how people practice iboga in Gabon might be different, but it's really, traditionally, it's about people coming together, being in ceremony, honoring their ancestors, and asking the divine to open their heart and create healing.
Thank you, Dr. Hayes. The next question is, what have you seen in the BIPOC community in regards to psychedelic medicine?
So in the BIPOC community, can you clarify that question? Because I want to understand the question so I can answer it better. What am I seeing in the BIPOC community in terms of psychedelic medicine? Well, I see a need. I see an invitation for there to be more therapists of color, physicians and therapists of color who are even aware of these medications as an option. So I see an invitation to increase the training of therapists and physicians of color who are aware of, committed to, and able to provide these therapies. Moreover, I'm just going to say the largest thing that's very important to understand is that, let me go high level. Please stop thinking that you can treat social violence and trauma with a pill. You can ameliorate things, but unless you actually change societies that we live in, you're just kind of putting Band-Aids on a gushing wound, right? And so we have to address economic inequality, social injustice as actually the upstream things that are causing people to experience distress. And if you are part of what's called a historically marginalized community, it is so important that you get your mind right about how the stories of the world have been against you and separating you from your divine knowledge of who you are. So you have to undergo cultural competency to know who you really are. And then, in addition to like supplementation with treatment with things like psychedelic medicine and trauma work or trauma-informed care, because it's not enough to just think we're going to give poor people. I was in a meeting and someone was saying, let's give the person who presents a psychological crisis who's homeless, then we can give them psychedelics. And I'm like, no, can we address the fact that this person is homeless? They don't have a home to go to, that our society is so disintegrated that we're actually creating these outcomes. So you can't just like give someone a pill and expect everything to be better. And so for people, and I'm going to just address all populations that I care about all populations and I love all populations, but I'm going to address a few that are at the top of my mind. For communities of color, you have to understand, come into kind of a radical consciousness about who you are and how your labor and your worth have been separated from you in terms of the stories that we live in this modernity, right? So how do you value yourself if the color of this chocolate that I get to live in has not been valued, right? So how do you learn to love and value yourself, right? For queer and trans communities, I just did anesthesia the other day for a M to F surgery, right? And a lot of this patient populations, there's comorbid diagnoses of anxiety, depression. But really, like, what does this mean when society cannot recognize who you are or your worth? Or because of your identity, you are more subject to violence, right? We look at the rates of suicide in Black trans communities, because people who have double hits of being vulnerable and more subject to violence in society. So my job is not merely to expose someone to a psychedelic medicine. My job is to figure out how can you love yourself, own yourself, know yourself, and also how can we create a society that knows you, honors you, recognizes you, and does not subject you to violence, right? Because I'm tired of, my choice is to change the world, not merely to medicate the world, to give pills for symptoms versus to give cures, right? So the more I can create a world where we are valuing all people, where we are living from the highest intention of love and inclusion, I don't need to give someone a psychedelic, because I've created a health justice, I've created equity and inclusion, right? I've decreased the trauma that has made psychedelic medicine so necessary. I went off there. I don't know if I answered the question.
No. We love it. Eating it up. The questions are coming. I'm getting questions via text on my cell phone, getting them in chat, getting them in the Q&A. Oh, Lord. So the next one, does this flood dose ruin your receptors and cause you to be more depressed in the long term?
So this is the amazing thing about treatment with psilocybin is that no, and it has a completely different mechanism of action, or than you would say from SSRIs. SSRIs are actually associated with numbing, and let me just talk a little bit of science. There's an area of the brain called the amygdala, which is really associated with your stress response with fight or flight. For people who have PTSD or anxiety, there can be amygdala hyperarousal. And the interesting thing about SSRIs is that it decreases activity in the amygdala. but that also might be associated with the numbing and distancing that people talk about when they experience SSRIs. However, the psilocybin, for example, is actually associated, while people are under treatment with it, are associated with increased activity in the amygdala, which is surprising because you increase the activity in the amygdala, and then people have and then it goes back to normal, but then people have long-term benefit, lasting benefit from psilocybin. What does that imply? What that implies is that psilocybin is actually giving you an experience of stretch, even like heightened arousal, that actually builds resilience and emotional endurance. And this is why it's called a trip or a journey, because people can actually have experiences that are challenging. So that heightened arousal, that heightened activity in the amygdala is actually building resilience. And so instead of like what someone implied in the question of like destroying your receptors, it's actually providing a robust neuropsychological rehabilitation. Because if you look at things like anxiety, depression, and things like this, you can look at them from the point of view of it being a chronic stress model of disease. A chronic stress model of disease, and your neurological system is just so burnt out and frazzled, and you need neurological rehabilitation. That rehabilitation can come in the form of psilocybin, and then you have neuroplasticity to help you further heal.
A couple of people said, nicely said, that was a great answer. Preach, keep bringing it, Mellody, kabam. That was David Bronner, of course, right? Kabam. We have another question. Another viewer wrote, I really appreciate this perspective on psychedelics being a tool, but not panacea for societal problems, including inequality and injustice. What should white supportive voices of BLM be saying about the need for advocacy in a racial justice context?
So thank you so much for your question. It is profound and very near and dear to my heart. So psychedelics are a catalyst for change, but you are the change. You are the vehicle of the change. And your question really it shows that a willingness to step up and take responsibility to deconstruct, to further deconstruct the systems and the beliefs and the cultural practices that are in place that cause us to live separate, that cause us to live separate from one another, or continue in the stories of what I call pseudo-speciation, that you just wouldn't see me as your own, right? And so what I hold is that we are in a failed post-war reconstruction. We started the work, but we didn't finish the work. There was efforts in post-war Germany to what's called, I believe it was called denazification. So the people who were in power, who were like Nazis, who held the Nazi ethos and cultural beliefs, there were efforts to take them out of power, because the Nazism, like, you didn't want that to perpetuate in your government. America didn't do that, right? So the people who held very racist beliefs, they not only did they maintain in power, but they, were, Andrew Jackson was like elected to president. That was consistent with the time. However, we are still in post-Civil War, a failed reconstruction, and we have to finish that work. That means anti-racism work. That means working on white fragility to actually even acknowledge the ways in which systemically this system has been built to economically preferentially advantage people of pale skin. And there are consequences and forces that are really have been systemically in place to disadvantage people of darker skin. And how can we be in relationship with those truths in a way that's radical, open, and honest, so that we can actually make different choices? And I'm going to just pivot for a moment to say, I think it's very useful to talk about policy, but everyone's an individual. Everyone's an individual, and everyone I will get down on some conversations about the policy initiatives. But the take home message, because everyone's an individual and everyone has responsibility, is that it's the choices of your heart that create policies. It's the choices that you make every day to see everyone as worthy and lovely that then get translated into policy initiatives that pass, right? So you have to will in your heart to be love and live love for all people. Why this is so important is because in healthcare, there are systemic issues of inequality in not just in access, but once you have access, I don't care if you have care as good as Kaiser. Kaiser still has health disparities. Why? There are universal protocols that say we treat everyone the same. You have a pain level of this, we give you this medication. If you come in labor with these symptoms, we give you this kind of evaluation. If you say you have chest pain and it gets radiated to your arm, we think you have a heart attack. But these systems don't work if you're Latino. If you're Black, you come in with the same symptoms and people look at you like, yeah, you're saying you have a headache, blah, 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 you just gave labor. I don't know why I'm not making preeclampsia for you, right? These different things happen, different outcomes are happening for different populations, right? There's no protocol or algorithm that I'm going to put in place within a system of healthcare, for example, that's going to change that. The only thing I can do to change that is your choice to love everyone and to look at your heart and see what are the barriers to loving everyone, right? So we already have laws against discriminatory lending. That doesn't mean it doesn't happen. So the law that I'm encouraging is the law that's on your heart for how you're going to show up and live love for everyone. That is as much as a role as for a police officer as it is for a grocery clerk, because you can either spread forward like animosity or hatred, or you can spread forward love. And as we make these commitments to live from our love, to live from our ethics of inclusion and diversity, our set point for what we will tolerate about how people are treated will be different. You know, my vision for America is that when we see the example of George Floyd, first of all, those are historical examples because I see different in the future, right? If anything like that happened, our whole community, our whole collective being would say, no, not in America. That doesn't happen. That it would be inconsistent with our values and our beliefs that could happen in this nation, right? That comes from an ethos and a belief. That doesn't come from policy. This comes from everyone and what they stand for, right? So I stand for love. I stand for safety. And I stand for the well-being of all people. And from that stance, and I invite you to make that your stance too. I invite you to make that your stance, because from that stance, we'll make some policies, right? From that stance, we'll change the world, right? From that stance, we'll create more physicians of color and more people providing better care in hospitals, right? But it's not from just from laws, it's from my heart. And there is a law written on my heart, and that law is love, right? So I just invite you to invite that law into your life as well, because how you're showing up, how you're going to create your workplace, you know, the procedures and practices in every place of work will be different. How you show up as a teacher, how you show up as a student, everything will come from the law of love that's written on your heart. Yeah, I preach there. Okay.
No, I just love how you bring it back to the heart. You know, it's beautiful. It's about love. It's about how we show up. And that's a beautiful message. Somebody said, this is so beyond, exclamation point, exclamation point. I love it. Thank you for taking this time to speak with us. And I have a question that from somebody who says, my sister has intense migraines going on for 10 years. Could this therapy help? Thanks.
You know, the wonderful thing about psychedelic medicine is that it is the integration of everything. It's the integration of science, clinical science. It's the integration of spirit. It's the integration of emotion. It's the integration of, you know, ancestry and story. So there are multiple reasons why someone might present with migraines, and only one of them is explained within the traditional clinical model, right? But maybe there's narrative causes, maybe there's traumatological causes, maybe there's, even people will go as far as ancestral causes for why someone might be presenting with pain. As an anesthesiologist, one of my areas of passion is actually pain management. And really a growth area soon will be how psychedelic medicines will be applied to pain. And what I'll talk to you anecdotally as well. LSD I've heard stories about LSD being effective for migraines. Likewise, it's in the clinical literature, there's some indications of efficacy of ketamine for migraines. And so, all manners of modalities, I mean, doing the therapeutic work to see if there's a emotional cause or root cause for the migraine disorder. And also just like clinically, there is a role for medications that are coming in a pipeline, LSD, MDMA, Iboga, et cetera. And then medications that are currently legal, the only legal psychedelic we have is ketamine. There's already clinical research saying that are indications for ketamine in the treatment of migraines.
Thank you. The next question is there any information on psilocybin being effective in treating traumatic brain injury symptoms like headaches, anxiety, mood swings, depression, or any personality changes? Thank you.
Thank you so much for that question. And I think what your question points to is that the changes associated with traumatic brain injury are complex, right? So some might be an anxiety, depression, and some might be like the frustration of the cognitive changes that are associated with the traumatic brain injury. So if you're not able to cognitively function as well as one was able to, that might lead to anxiety, depression. And so what environmental and functional supports would someone need to have to mitigate the frustration and social barriers so that they can mitigate their experience of anxiety and depression? Could psilocybin have some efficacy for TBA? Wow, that's an amazing area of research. So again, how can we support more research? There are trials going on looking at psychedelic medicines for treatment of Alzheimer's disease and other places where you would want to kind of encourage neuroplasticity, right? There, anecdotally, again, I can tell you the story of someone who told me that I think the substance that they use, again, not recommending, I'm literally just telling a story about what someone told me, that they use LSD as a part of their recovery from a traumatic brain injury. I personally, my mother experienced a traumatic brain injury. I know how devastating it can be. So I'm sending much love and much compassion in your recovery pathway. This is a really interesting thing because historically, we thought post-stroke there was no recovery. And what we learn more and more and more as we get smarter and more humble about how magnificent, robust, and innately healing the body is, that recovery is still possible, that through rehab, functional rehab, and also through the possibility of psychedelic medicines and neuroplasticity, there are pathways to recovery. And I'm just wishing you much growth and much expansion in your recovery pathway, because I just know it's a very challenging condition.
Thank you, Dr. Hayes. I think David Bronner might be popping on shortly. In the meantime, hey, David, welcome back.
Right on. And so, and are we wrapping, or what's going on?
Oh, well, we will be after maybe one more question.
Yeah.
But I thought you might want to come back on and maybe have a few words to share or a question for Dr. Hayes.
I did have to take one call, and Bettina, I texted with Bettina about Laura's question about if a flood dose would ruin receptors, but Dr. Hayes knocked it out of the park. Is that right?
Yeah, we already addressed that question. We did already.
Bam. Yeah, well, I mean, this has just been incredible. And why don't I get out of the way and let another question get answered?
Thank you so much, Dave. Thank you. Wow. I have to add, David, our cosmic engagement officer, as you know, is also an alumni of Harvard. And so you guys have that in common, also being, warriors for, bringing psychedelic medicine to everybody who needs it. It's wonderful that David connected us to you. And we are so thankful that we were able to meet up and have you share your story and talk to everybody about what you do and how you do it, and share some insights and answer all these wonderful questions. And we do have time for one more. And this one is, can you speak to what you think the next move is in the psychedelic community to support POC gaining more access to this healing, both in trial studies and as we push for legalization? Thank you for all you are doing.
So this is a excuse me for the if I'm gonna let the ambulance go by. This is a massive strategy question. So how do we actually create access to healing and liberation for all people, especially communities of color? And so really, if you think about, and this is just a strategy question, really if you think about it, the healthcare, the history of medicine within the West is burdened with the history of racism. A lot of the research and science that we are currently using come from experimentation on vulnerable populations, be that prison populations. Comes from it's a lot of the OB-GYN has a history of like without anesthesia experimenting on Black bodies, right, on Black women. And when you look at our outcomes right now, we actually understand that there is racism within the healthcare system. There is an initiative. We are all one, right? We are all one. We are all the same being. Yet only recently are we taking out race-based metrics. For example, in measuring renal function, there's a very effective movement right now to say, hey, we don't think our kidneys work differently based on our race. So let's remove that from the practice of clinical medicine. So on the one hand, you can medicalize these substances and bring these substances into a medical system that already is burdened with the legacies of systemic racism, or you can create decriminalization. But the larger thrust, if you actually thought about it, the larger thrust of decriminalization is actually to have a conversation about drug policy in the US. Drug policy is actually, if you look at the history of it, it comes with racist intents, right? The idea was that if Mexicans were doing marijuana, they'd be more likely to sleep with a white woman. If Chinese people were doing opium, they would be more likely to sleep with a white woman. All of this comes from like some latent, like not latent, explicit racism. This is in the literature. So really, if you want to provide access to liberation, health, healing, you actually have to look at how do we change our laws and our attitudes about drug culture or drug laws, because believe it or not, Black, white, Asian, blah, 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 do these substances at equivalent rates, but actually experience criminal consequences of these substances at disproportionately rates that disadvantage communities of color, right? And so we've criminalized and penalized people of color's access to transcendence, experiences of transcendence. And that means making illegal traditional religious practices, making it harder for Native American communities to experience transcendence. Some people say that marijuana is a profoundly spiritual medication, making illegal access to marijuana. And so as a point of strategy, if you believe that access to psychedelic medicines are an important part of health justice, of social justice, then decriminalizing access, I think, is the most robust, strategic way, because as a part of that conversation, you have to have a conversation about drug policy and the war on drugs. It will create pathways within communities for them to take responsibility for their own health and their own well-being. I love being a doctor, but there are ways in which this, this white coat separates you from the knowledge that you can heal and you can transform your own life, right? If you keep coming to me and looking to me for the solution to your diabetes, blah, 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 how does that stop you from forming a group in your community where you guys are doing daily 6 a.m. walks to get yourself right versus just asking a doctor for more metformin? So giving the tools of healing to communities is a very important pathway to liberalize access to health and welfare, right? Because your relationship with your body, your spirit, and your mind is a daily relationship that you are responsible for. It's not a 3-month visit with a doctor. It's a daily relationship that you're responsible for. And so how do we give those tools to everyone in economically affordable ways, in ways that do not privilege certain populations, in ways that do not subject people to further exposure to systemic racism that still exists in healthcare, or the consequences of the law, which are still, still encoded in our laws, this disproportionate disadvantage to communities of color based on our current drug policy. So as a strategy, I think decriminalization of safe substances is a pathway for healing from anxiety, depression, PTSD. However, again, it's not substances, it's a substantive change in our society that will lead to long-term wealth and health for all communities, right? So again, it's never about drugs or substances, it's about the substance of society that we live in,
Yes. Thank you, Dr. Hayes. Thank you for being in your excellence. Yes. Thank you so much. And so we are out of time, and please tell us, where can people find out more information and where can we find you?
Yes, please go to www.drmellody, that's DRMELLODY.com. I am launching a campaign called How We Heal. Please share your stories of healing with psychedelic medicines with me. There's information how you can post to Instagram to share your stories of healing with me, so that we can understand more about how we heal, not just with psychedelic medicines, but also through social justice. We are at the moment in history where we can call this the last generation so profoundly separated by systemic racism. And how we heal is a conversation about how do we create a world where we know we are all one. So please go to drmellody.com, learn how you can share your story of healing with psychedelic medicines, healing through community action, healing through social justice, healing through truth and reconciliation. Again, drmellody.com is how you can stay in contact with me, sign up for my newsletter, and share your story of healing.
Fantastic. Thank you, Dr. Hayes. Now, go save lives. Thank you, thank you, thank you. Have a great rest of your day. And team, everybody, our next speaker is Jolana, our very own Jolana Watson, on November 19th, talking about bystander intervention. So shout out to James and Tim for setting us up on this new platform. Andrea and Mario, our translators, our CEO, David Bronner, and our president, Mike Bronner, for allowing us to do this. Have a beautiful day, everyone. Thank you again, Dr. Hayes.